Hello guys, I hope you are all well. So today I wanted us to discuss something about gonorrhea. Because gonorrhea has wide concepts, I divided it into 10 parts which will enable us to understand gonorrhea better. So in the first part, I will be introducing you into what is gonorrhea. In part 2, the pathogen. Part 3, valence factors. Part 4, pathogenesis. Part 5, epidemiology. Part 6, transmission. Part 7, infection in males and the women. Part 8, neonatal and pediatric infections. Part 9, lab diagnosis. How can we confirm person has gonorrhea? Part 10 is about treatment and prevention and control. Now, let's go into introduction to gonorrhea. Okay, guys, gonorrhea is just an bacterial infection that is transmitted through sexual contact or perinatally. Perinatal transmission perinatal transmission occurs mostly when you wear or you share clothes with someone who has gonorrhea. Now, gonorrhea organisms or organism which cause gonorrhea affects mucous membrane. It affects mucous membrane of different parts of the body. And these parts which are mostly affected are urethra and cervix. That is mucous membrane of these regions. But there are other areas which are affected but not mostly frequently, and these areas include the rectum, oropharynx, and the conjunctiva. That is the conjunctiva of the eye. Now, history about gonorrhea. It is one of the oldest illness. It's one of the oldest human illness because in some Chinese writings, and in biblical Old Testament, that is Leviticus, we can find a reference to a sexually we can find a reference to a sexually acquired urethritis. Also, we have this person called Galen. Galen is someone who introduced the name gonorrhea. Gonorrhea means flow of seed. It means flow of seed. That is, he saw a male patient with this kind of disease. Then those kind of products which were coming from his pen, it looked like semen. That's the reason why he called it gonorrhea. Now we have this person called Neisser. Neisser is the person who described organism causing gonorrhea. And this kind of organism, it was called Neisseria gonorrhoeae after him because he's the one who described it in 1879. We have this guy called Loeffler and Leitsko. These are the people who first cultivated this kind of organism which was described by Neisser. That was 1882. Now, gonorrhea epidemiology can be affected by social, behavioral, and demographic factors, despite of the effective drugs which we find in the market. Okay, once gonorrhea organism affects cervix, it is in women. It can cause what we call ascending genital infection. This kind of infection, it affects uterus to cause endometritis. It also affects fallopian tubes to cause what we call salpingitis. That is inflammation of a fallopian tube. Also, this endometritis, it's inflammation of endometrium in the uterus. These two diseases are collectively called PID, that is pelvic inflammatory disease. And this kind of a disease cause what we call female infertility. How is the female infertility caused? Now, when salpingitis occurs, that is inflammation of fallopian tube, it makes ovum not to end uterus. So, this kind of ovum can't meet what we call a sperm. And if there is no sperm, and if there is no sperm and ovum meeting, they can't produce a kid. That is how it causes what we call female infertility. And guys, that is introduction to gonorrhea. Let's meet at part 2 to discuss about pathogen causing gonorrhea. And that is the end. Let's meet at part 2. Bye.